Hello everyone, welcome to Vital Line Nurses. In this video, we're going to break down ventilator modes and settings made super simple for nurses. Let's get started. Before we dive into ventilator settings, alarms, and modes, let's start with one simple question. Do you know what a ventilator is? If you already know something about ventilators, go ahead and drop a hands up in the comments section. Okay, don't worry if you're not sure, I'll explain. A ventilator is a machine that helps a patient breathe by delivering oxygen to the lungs and removing carbon dioxide, especially when they can't do it on their own. So let's explore the ventilator step by step, simplified for every nurse. Now that we understand what a ventilator is, let's move on to the next part. We are now going to discuss the purpose of mechanical ventilation. Yes, let me explain. Ventilators are used in critical care to support or completely replace a patient's breathing, especially when they're unable to breathe effectively on their own. Here are the most common clinical situations where ventilators are used. Mechanical ventilation is commonly used in the ICU, in emergency situations, or during surgery under anesthesia. It's essential for patients with respiratory failure, head injuries, spinal cord trauma, or neuromuscular disorders like Guillain-Barré syndrome or myasthenia gravis. Now let's move on to the basic ventilator settings every nurse should know. The first setting is FiO2, the fraction of inspired oxygen. It controls how much oxygen the ventilator gives to the patient, and usually ranges from 21% to 100%. Next is tidal volume, or TV. This is the amount of air delivered to the patient with each breath. It's usually based on the patient's ideal body weight, around 6 to 8 milliliters per kilogram. The third setting is respiratory rate, or RR. This is the number of breaths the ventilator gives per minute. The fourth setting we have PEEP, which stands for positive end expiratory pressure. It keeps the alveoli open after exhalation to improve oxygenation and prevent lung collapse. Finally, there's pressure support, or PS. This helps reduce the effort needed during spontaneous breathing, especially useful when weaning a patient off the ventilator. Got it? Comment PS understood, if that was clear. Now that we've covered the ventilator settings, let's move on to something just as important, the ventilator modes. Modes tell us how the ventilator is supporting the patient's breathing, whether it's doing all the work or just helping out. Have you heard of CMV or SIMV before? Drop a paper in the comments if yes. 1. CMV, AC, continuous mandatory ventilation or assist control. The first mode is CMV, also called assist control or AC mode. In this mode, the ventilator delivers every breath, either on a timer or when the patient tries to breathe. Each breath is the same size, and the ventilator doesn't allow the patient to control the volume or rate. 2. SIMV, synchronized intermittent mandatory ventilation. Next is SIMV mode. Here, the ventilator gives a set number of breaths, but the patient can also take their own breaths between them. It's a good mode when starting to wean a patient off the ventilator. 3. CPAP, continuous positive airway pressure. In CPAP mode, the patient breathes completely on their own. The ventilator provides continuous pressure to keep the airways open, but it doesn't deliver any breaths. This is often used when a patient is ready to breathe independently. 4. PSV, pressure support ventilation. Lastly, we have PSV, or pressure support ventilation. In this mode, the patient initiates every breath, and the ventilator helps by reducing the effort needed to breathe in. It's commonly used during weaning. Still with me? Comment PSV clear, if you got it. Now let's quickly go over ventilator alarms. They alert us when something needs immediate attention. Ever heard that loud beep in ICU? That's a ventilator trying to tell you something. 1. High pressure alarm. This alarm means there's too much pressure in the airway, usually from coughing, secretions, or a blocked tube. 2. Low pressure alarm. This means air is leaking or the ventilator isn't meeting expected resistance, maybe from a disconnected tube or leak. 3. Apnea alarm. This goes off when the patient stops breathing on their own in spontaneous modes like CPAP. Once the patient is improving, it's time to think about weaning. That means slowly reducing ventilator support until the patient can breathe on their own. Ever seen a patient extubated? Type yes in the comments if you have. Signs the patient is ready to wean. 1. Stable vitals. Heart rate, blood pressure, and oxygen saturation should be stable. 2. Good oxygenation. The patient should maintain good SpO on low FiO2 and low PEEP. 3. Alert and responsive. The patient should be awake enough to protect their airway and follow commands. 4. Breathing on their own. They should have an adequate respiratory rate and tidal volume with minimal support. Now that we've learned about weaning, let's go over what matters most: the nursing care we provide to patients on ventilators. Nurses are the first line of defense. If you agree, drop a heart in the comments. Key nursing responsibilities. 1. Monitor the patient and ventilator settings. Always assess the patient first. Look for changes in breathing pattern, vitals, or level of consciousness. Then check ventilator settings to ensure they match the order. 2. Prevent ventilator-associated pneumonia, VAP. Provide oral care every 2 to 4 hours. Keep the head of bed elevated 30 to 45 degrees, and use sterile suction techniques. Type: prevent VAP. To remember this important step. 3. Suction the airway as needed. Suction when you hear gurgling sounds, see visible secretions, or the patient is coughing and desaturating. 4. Secure the endotracheal tube, ET. Check tube placement regularly, prevent dislodgement, and rotate the tube position to prevent lip injuries. 5. Respond to alarms promptly. Never ignore an alarm. Assess the patient immediately, then the machine. Your quick response can save a life. 6. Document everything clearly. Remember, your skills and vigilance at the bedside make all the difference. Be proud of the care you give. Ventilator patients need your eyes, hands, and heart.